friends, especially those of you in your 30s, 40s, and beyond, this one is for you. If you've ever asked yourself, how do I know if I'm actually ready to start running again after this injury that I just had? You are not alone. Most of us in this stage of life don't bounce back like we did in our 20s, let's face it. We're balancing work, family, stress, and sometimes recurring pain. So it's no wonder that so many runners over 35 deal with repeat injuries or feel stuck in the start-stop cycle of injuries in running. Today, I want to talk about a tool that may help you break that cycle, and it's the Running Readiness Scale. This could be the key to knowing if your body is really ready to handle running again, so let's break it down. What is the Running Readiness Scale, or RSS, was created as a way to test how ready someone is to handle the physical demands of running. It includes 5 simple bodyweight tests that assess your strength, control, and stability, and things that I do with all of my patients in the clinic and on my virtual platform. So here's what you'd be asked to do. I would ask you to do double leg hops, 160 hops per minute, a 60-second prone plank, step-ups, 160 per minute, single leg squats to a rhythm, a wall squat using a gym ball. Each test is then scored as a pass or fail, and to pass, you need to keep your hips level and your knee from collapsing inward for the entire 60 seconds of the test. So the idea is simple. If you can't control your body during these low load tasks, you probably won't be ready for running and the higher impact forces of running. Why does this matter for runners over 35? If you're like most of the runners I work with, you've probably dealt with some combination of hip, knee, or foot pain over the years. And for many of us, the root issue is poor motor control, especially around the hips. That's why this next part really caught my attention. In 2023, researchers found that the RSS could actually help identify runners with movement patterns like hip drop, pelvic instability, and knee drift, which are all common culprits behind injuries like IT band syndrome, patellofemoral pain syndrome, and even plantar fasciopathy. So this isn't just about passing a few tests. It's about identifying how your body moves when it's under stress. When you score well on the RRS, you're less likely to show that hip drop or knee collapse during actual running. If your joints are better aligned and your muscles are doing their jobs. If they're not doing their jobs during these test activities, they're not going to do their job during running. Recently, a brand new study in the Journal of Athletic Training looked at this scale in 113 collegiate runners. Yes, a little bit younger than us, but still. They tested everyone at the start of the season and then followed them to see who got injured. And here's the crazy part. Runners who scored 3 or less on the RRS were nearly 5 times more likely to get injured than those who scored higher. Even more surprising, those who failed the wall sit were 26 times more likely to get injured. I didn't misspeak. But before you panic about your wall sitting abilities, that number came from a small group. Only 5 runners actually failed it. So it's promising data, but it still needs a larger sample before we can draw definitive conclusions that failing that test actually does increase your risk that much. Here's where this gets personal for those of us over 35. Our bodies are different than those collegiate runners. Our recovery is different and our risk of injury is already higher, especially if we're juggling old injuries, hormonal changes, or just haven't prioritized strength in years. The RRS gives us a snapshot, a way to check in with our body before jumping into running again. But, and this is an important fact, it doesn't test impact tolerance on a single leg, which is crucial if you're just coming back from an injury. Running involves ground reaction forces up to 3 times your body weight on one leg. Of the 5 RRS tests, only 1 includes impact, and it's on both feet. So if you've been dealing with injuries like shin splints, stress fractures, or tendon pain, you'll need more than just this scale to truly assess your readiness. So how do you use it? Here's how I use the readiness scale in my virtual physical therapy clinic and rehab coaching. I use it to evaluate movement patterns that could lead to injury, to identify weak links like quad endurance if you can't hold the wall sit. I use it to create a baseline during a rehab plan or injury screening. And then most importantly, for my runners who are working to stay injury-free long-term, But I don't use it alone. I pair it with impact testing, gait assessment, and load progression to make sure you're really ready for that return to running. If you're coming back from an injury, especially something like a tibial stress fracture, shin pain, or plantar fasciopathy, you'll want to check out my next video. We're going to go deep into 5 key tests for returning to running after injury that goes beyond the running readiness scale. And we'll really talk about each of these tests and how to do the running readiness scale in completion. And we'll also include impact drills and symptom response strategies that actually work for runners over 35. Until then, keep your recovery intentional, your strength routine consistent, and remember, you're not too old, you're just underprepared, and let's fix this. I'll see you guys next time.